I feel India has made a huge progress in economy, in space, in technology. If you look around the sprawling city, beautiful highways, however, the gap between the rich and the poor has increased. In India, we have close to 200 million Muslims. If you look at it, education, jobs, loans, housing, healthcare, in most of the sectors, Muslims have not improved. We try to provide as much as possible the basic need. When we started, I remember we were very happy with the budget of $100,000 and we provided maybe 50,000 meals. Last year, we have provided close to 10 million meals. We have provided thousands of scholarships to the students across the skill development programs, running more than 130 schools, 5 clinics. We built the hospital. We are building another hospital. IMRC itself has close to 400 employees in India.
Most economically underprivileged people in India are minorities, and most importantly, it's the Muslim minorities. One of the most beautiful things about the work over here, it is into almost every area of importance, be it education, be it healthcare, be it social services, or be it their futuristic vision into the technology space. So the kind of efforts they're making is very proactive.
The school that you're looking at was built during COVID, which was focused on applied English and math. Things like coding and robotics, we wanted them to get hooked to this entire philosophy of getting skills. And the goal is to be able to create a whole generation of leaders who can get into anything that they want to because of the skills that they have acquired in the school.
In last 4 years, Sahayata Trust and IMRC is trying to put more concentration on skill development projects. We want our young generation to get some good skills so that they can get good jobs or they can start their own business. We have trained more than 10,000 students till now, and out of 10,000, 4,500 students, they have already got jobs, and about 100 and 150 started their own business. Though these businesses are very low level, but a small beginning can take them a big way.
We are running 13 centers. They learn the skills of their interests, like plumbing, electrician, basic computer skills, and English. These students get small salaries, but since they have nothing, it's a big help for the family. So at least they can put food on the table.
My vision and dream is that Sahayata and IMRC put together should provide 1 lakh jobs. Right now, in 1 lakh, I have achieved only 4,500. So still only 95,500 is valid. So with the support of all our donors, with the support of our chairman, with the support of all our trustees and all our well-wishers, I wish I could complete this dream in 4 years.
What IMRC and Sahayata Trust have done is that they have chosen places, specific areas with the most economically disadvantaged population, and they're catering to them. Talking about the adventure camp, that is one place that is very close to my heart. Right now, with the help of Sahayata, they are trying to give the same type of skills that are very relevant to the new age economy to marginalized populations, and as it was mentioned earlier, to a lot of minority women who are learning the essentials of coding, of incubation, etc. Some have already built wonderful companies, some have sold them. So that is a very refreshing thing to see amongst the youth of India.
This is entrepreneurship and innovation. Any students who have the idea, give them the opportunity to produce and invent. And I'm really excited to see more than 50% of the girls, young girls, having these ideas and trying to implement it. Within a year, entrepreneurs started a company and sold it. We already sold 2 companies, these guys, so I'm so proud of them. We acquired Raja's Fort Palace, which was in dilapidated condition in 1999. It took 6 years just to clean it up, get rid of the snakes and the monkeys. I'm really happy about the pharmacy college, which started last year. We want to encourage masters and doctorate program. And I'm very hopeful that the College of Pharmacy will do some research. In Jahangirabad, we have the Media Institute, we have the radio station there. We have produced at least 200 employees, editing, camera people, script writing. Media is extremely important. We need our representation of our community. Imagine 200 million people, they don't have a TV channel. In India has hundreds of channels.
This place is satellite campus of GIT Media Institute, and we are offering 6 courses here. First is photography. Second is anchoring and journalism course. Third one is acting, editing, smartphone photography for YouTube users, and cinematography. Media and entertainment industry is going by the pace of 40% these days, and we are trying to make our students industry ready.
They have to be familiar with the technologies. That's why we have established through classroom, through our labs, we will teach them how to make a film, how to produce a video, how to produce contents relevant to the contemporary issues. So all these things we are going to teach them.
Why is it that I have access to this kind of schooling? And that kid that we met at Shahi Nagar, whose father tried to kill his mother, is into that kind of problem. It's not only that they are into the cycle of poverty, it's that the cycle of poverty impacts their mental, physical, spiritual, emotional, and all the other sorts of well-being. Muslims are the most economically disadvantaged community in India, and it's one of the largest minorities in India. So what happens is that these people firstly don't have any sort of education. They don't have any means to earn proper income. They don't have enough skills. So they fall into this vicious cycle of poverty, and that's generational. Individuals who are usually born into dire economic circumstances and do not have access to even basic resources resort to some other means to do that. We met manual scavengers who were in sewage walking over feces, and that is going to earn them about 50 rupees or 60 rupees a day. And the likelihood that this person's child might also resort to that kind of work solely because that man will not be able to help provide that kind of education to this child. And that's how trauma starts.
In medical, we have one hospital which is multi-speciality at Malakpet, and we have about 7-8 clinics where we are funding. The central idea here is to give medical care at affordable price. In other words, whatever amount you are taking from the patient, it should not have a huge profit for the institution, but it should have a huge impact for the patient so that they can comfortably pay and they can avail the facilities. Only one last year, more than 2,000 cases we have given under zakat and subsidized medical care.
Induya's hospital is one end of the city in Malakpet. Toli Chowki is on the other end of the city of Hyderabad. So there are hundreds and thousands of people who cannot get the service in Malakpet can get the service in Toli Chowki. We decided to open the Toli Chowki because after Induya's hospital we saw growing need, especially in the area of eye care. So we starting this hospital first with the specialty of glaucoma treatment, and as we go along add other specialties.
I'm Junaid Malik, pulmonary critical care and sleep medicine in Cincinnati, Ohio in the US. Came to help out because it was a nice opportunity and right timing. The patients, they're really needing some help. They don't know what to do. They don't have an option of going to a place or a physician, so this at least you bring the physician there.
This is a project mostly focused on the doctors giving back to the community. This is where thousands of these doctors are grown, went to school, and left for higher studies, better life.
It is with humility and gratitude that I feel that I can give back to the community what I have gained from my education. This country has turned out physicians without any loan, and it's time to give back. We do just like a basic screening here, help with treatment with simple ailments and illnesses what we can, and certain other things that are more chronic based or chronic diseases, we need help from the local doctors and we refer them to the general hospital.
And there is a tremendous need. There is a huge, huge need. I urge all the doctors to come either a week, 2 weeks. If you're retired, come for 3 months, 2 months. We will take care of you. We will provide you the best facilities, transportation, everything we can. Come with the purpose to serve the poor and needy.
So busy pulling people out of the river from drowning that we're not seeing why they're falling into the river in the first place. We need to understand the root of the problems. I think that is one potential I see with Sahayata Trust and IMRC. They are into understanding the in-depth nature of the crisis altogether. Having such institutions like CDPP or be it Sahayata Trust or the media to help cater to every individual aspect of upliftment. How Mr. Manzoor Ghori puts it, he has spent his entire life making sure that every dollar reaches the right person in need.